frontline ambulance crew in the West Midlands in a pioneering scheme to reduce accident and emergency waiting times. Doctors working alongside paramedics see patients in their own home. It's been claimed that in 90% of cases, those patients are diverted away from hospital A&E admission. One of those GPs is Dr Marc Crutchley in Wolverhampton, joins me on the programme now. Marc, good morning to you.
Morning, Adrian.
So essentially then, West Midlands Ambulance Service hire a few GPs like you. You go out with the paramedics and thereby you can treat people who might otherwise go to A&E?
Yeah, that's basically it, really. As I say, it's a joint scheme with the CCG in Wolverhampton and West Midlands, who've been very proactive about this. And basically, if the paramedic staff feel that I can help and aid people from going to A&E who would otherwise have actually gone to A&E, and they give me a call, really, and I go and intervene if I can.
Isn't there a danger, though, that people will simply call 999 now, knowing that they'll get a paramedic and they'll get a GP as well? They'll get a doctor there.
I understand what you're saying. It's not as simple as that. As I say, it's usually paramedic referrals that we take, so it's only cases that we feel are appropriate. The actual paramedic crew. So there is a kind of mechanism there that they wouldn't be able to directly call to the GP, if you know what I mean.
I think I saw a similar scheme a couple of months ago in operation at Heartlands Hospital in it's in Birmingham, isn't it? It's Heartlands in East Birmingham.
Yep.
And the same sort of thing, which I guess is the same as ambulance service, West Midlands Ambulance Service, doing what you're doing. So the whole point really is to head off people going into A&E.
Yeah. Well, basically, it's to offer a better service in a way, because a lot of patients do not need to go to A&E. They can be treated at home, which is better for patient care, and it also has the benefit, of course, to actually free up some of the A&E beds and make it easier for the hospital, as well as saving the NHS money as well.
Marc, thanks very much indeed. Dr Marc Crutchley there, a scheme by West Midlands Ambulance Service, getting a few GPs going out with the paramedics. If you've seen a doctor and the doctor can give you first-hand advice there and then on the spot, the idea is that fewer people will be diverted towards accident and emergency, which we all know all over the West Midlands are under real pressure. Talking about the West Midlands High Street name,